What is arterial stiffness? It is an early detectable manifestation of adverse structural and functional changes that is happening in the vessel wall. And this has been found to be an independent predictor of overall cardiovascular risk and mortality. Atherosclerotic risk factors, we all know, predominantly being dyslipidemia, type 2 diabetes, high blood pressure, obesity, and a cluster of all these conditions together known as the metabolic syndrome. They are all the main contributors to an accelerated progression of arterial stiffness. We all also know that statins are the mainstay for treatment for cardiovascular diseases. So the question here is the link between statin use and the progression of arterial stiffness. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I am going to discuss about statins, the first-line lipid-lowering therapies which have been used widely to prevent cardiovascular diseases. Limited studies have investigated the association between statin use and the progression of arterial stiffness, which is seen as a key player in the pathophysiology of cardiovascular diseases. To examine the association between the statin use and the progression of this arterial stiffness in adults with high atherosclerotic risk that is being measured by brachial ankle pulse wave velocity, a recent cohort study was conducted and later on went on to get published in the JAMA network. The study that I'm talking about assessed the brachial ankle pulse wave velocity of close to 5,100 adults with high atherosclerotic risk, and it found that statin use was associated with a lower baseline brachial ankle pulse wave velocity and its slower progression when compared with the non-statin users. The statin users were those who were prescribed any statin medication at least 6 months before the brachial ankle pulse wave velocity measurements. The results also showed that among the 5,100 adults with the assessment of this velocity, 1,310 statin users were matched with 1,310 non-statin users. That was, the matching ratio was 1:1. And compared with the non-statin users, the statin users were associated with a significantly lower brachial ankle pulse wave velocity at baseline. Also, a significantly slower progression of this velocity was observed in the continuous statin users and high adherent users. Hence, it was concluded that statin use was associated with slower progression of arterial stiffness in adults with high atherosclerotic risk. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.